Howdy, Aaron Boster here with the Ohio Health MS Center, bringing you 20 tips to tackle depression in multiple sclerosis. Depression is very prevalent in MS, and studies demonstrate that people with MS are over twice as likely to experience depression as compared to the general population. We know that depression colors everything ugly, and today I present to you 20 different tips that might help you tackle depression. It's not my intention that you're going to run out and do all 20. It's my hope that as you listen, you may pick up 1, 2, 3, 5 that you could implement into your daily life. Number 1, clean up your diet. Unfortunately, the average American diet is packed full of processed and sugar-laden foods. This can make fluctuations in your glucose levels throughout the day, and that's been shown to contribute to depression. Consider an experiment where for a couple weeks, you eat whole foods, you decrease processed foods, and you try to remove sugar from your diet. You might be amazed at how much better you feel. Number 2, improve your sleep. We have videos on our YouTube station about sleep hygiene, and it's worth looking at. Improving the quality of your sleep can have a dramatic impact on your mood. Number 3, exercise. I'm not asking you to become a marathon runner. I'm not asking you to become a kickboxing champion. I am challenging you to walk around your block once a night after dinner. I am challenging you to get on your elliptical for 5 minutes during the commercials. I would ask of you to insert exercise just on the weekends to start off. You'll find that exercise is a powerful, powerful antidepressant. It's one of the most helpful tips in improving your mood. Number 4, take your MS disease-modifying therapy. The evidence is very clear. People with MS on DMT have an improved quality of life and an improved mood compared to people with MS not on DMT. Take your meds. Number 5, consider an antidepressant. Taking an antidepressant is one of the most helpful tools in managing depression. I don't recommend it in isolation. This is one of 20 tips, but it's a powerful, powerful tip. And I encourage you to talk to your provider about the option of starting a medication. A couple words about antidepressants. They generally don't work quickly. Oftentimes, we'll ask our patients to stay on an antidepressant for at least 6 weeks prior to deciding if it works. A second point. When you find that the antidepressant is working, there may be a desire to stop it because now you feel better. If you stop the antidepressant within the first 6 months, there's a high likelihood that you'll rebound. And so if you're going to take one, you may talk to your provider about committing to at least a 6 months course before you would consider stopping. Number 6, treat MS fatigue. We have YouTube videos specifically on fatigue. And in our clinical experience, depression and fatigue are very closely tied. Treating one requires treatment of the other. Number 7, addressing MS-related pain. If you show me someone who has pain, I'll show you someone that is sad about hurting. And if we can treat the underlying pain, it can do many, many things to improve our mood. Number 8, avoid drugs and recreational alcohol. This is important, and all too often we may reach for one to try to help our mood. In reality, many of these are depressants, and they can worsen our mood. And so in the setting of depression, we want to try to avoid them as much as possible. Likewise, we strongly recommend avoiding polypharmacy. Polypharmacy is when you're on way too many medicines. And all too often, well-intending physicians place us on yet another pill, and we forget to remove a pill. I challenge you, when you see your provider, ask them, which of these meds are no longer necessary? Can we try to decrease some of them? Number 10, avoid isolation. The data is very clear that people with MS may tend to isolate themselves at times, and you want to fight against that. It doesn't mean that you have to go out in crowds of people. If you're going to read a book, do it at a coffee house. Consider going to the park and being around other human beings. This can have a major impact on your mood. Create a routine. All too often I hear people say they don't know how to get started. They're not sure what to do. Simply adding a routine to your daily schedule can benefit you. It can create structure in your day and ultimately improve your mood. Likewise, consider setting goals. Number 15 is to set some goals. Now, they don't have to be outrageous. They can be very, very simple. On Tuesdays, I'll take out the trash. I'm going to make sure to call my mom. These simple things, you can create a checkbox, and when you do them, check them off and have what I like to call small wins. Setting goals can be very, very helpful. Try it out. Number 13, keep a journal. Write down your thoughts, write down your emotions, write down a poem. Try to keep a daily journal. Many of our patients find this to be very, very helpful in combating depression, particularly in challenging negative thoughts. Read back through what you wrote. See if it makes sense. Keep a journal. 14, start a garden. Be involved in a small box garden, a window box. Plant a couple flowers. Play with the earth and be in the sun. And it can make you feel better. I find that rooms that have plants brighten my day. Consider starting a garden. This is arguably my favorite one, number 15. Get a pet. I personally have enriched my life greatly because of my dog. And there are so many positive things about having a pet. They provide companionship. No one is happier to see you when you come home than your pet. They help create structure because you got to take them out to go potty. And so that helps create structure throughout your day. And it can encourage exercise. Throwing the ball with your dog or going on a walk can have a major impact. Please consider number 15 and get a pet. Talk therapy is very, very important. Talk therapy involves sitting down with an objective, trained listener. This can be a rabbi, priest, pastor, a social worker. This can be a PhD therapist, a counselor, a psychologist, a psychiatrist. It needs to be someone who's not intimately involved in your life. When you tell your spouse that you're sad, your spouse feels sad. And that intimate relationship doesn't always lend itself to uncovering things and to helping you in the way that we need. In addition to that relationship, we sometimes need to seek out a trained listener. Now here's a tip. You have to like the person that you're doing talk therapy with. Otherwise it won't work. And so seek out someone that you connect with. Try this out. In my experience, this is as powerful as taking an antidepressant. And it's synergistic. 1 + 1 is 3 when you add antidepressants with therapy. Number 17, consider a support group. Different from talk therapy, surrounding yourself once a week or once a month with people that have a similar experience can be very, very profound. It's helped our patients a great deal, and I strongly support number 17. 18, reach out to the members of your village. In our experience, the larger the village, the better. And if you haven't talked to your second cousin who lives in Iowa, give her a call. Reach out to your village. Don't isolate, but try to grow your village. You don't need to call someone and say, I'm feeling sad. Just call them up and check on them and have that interaction. You want to strengthen the village that you have. Number 19, try to do something fun. Even if nothing sounds fun, fake it. And you may find that for a couple minutes that you really enjoyed yourself. I want you to have this experience, and remember that life is supposed to be fun. Number 20 is something that I like to refer to as non-talk therapy. I challenge you once a week to leave your home and to do an activity that is not for your health, it's not for your family, it's not for your job. It also needs to be not on your schedule. It needs to be something like taking a class at a community center or attending a reading group. something that's outside your schedule that forces you to plan. Non-talk therapy can be very, very helpful in combating depression. Aaron Boster here, again, reviewing 20 tips to combat depression. Thank you for tuning in. Have a great day.